Brandon, what were you just doing there on the floor? And could you demo it for our audience?
Oh yeah,
really quick?
I was doing the world's greatest stretch right there. I had to do it, every time I'm sitting down for too long. Right here,
Yeah.
elbow to ankle, rotate. World's greatest stretch.
All right, there it is. We're not even going to get into why it's called the world's greatest stretch right now. But you were saying you would do it every morning?
Oh yeah, because I was reading the 5 a.m. Club book.
Yeah.
And it was telling us how in the morning you want to set the tone of your day with some kind of movement. So
okay. So what better than the world's greatest stretch?
World's greatest stretch. So you've seen the hallway at my apartment. So
Yeah.
I would literally get out of my bedroom because Paige is still sleeping, and I'll literally just do the world's greatest stretch, some thoracic rotations, there, maybe some inchworms, some shoulder taps. Just to get some core activated.
I like it.
And hop right in the shower.
Cold shower?
Not this season.
You gotta get on the cold
Dude,
showers.
I'm wearing a hoodie right now. That's how you know it's
bro.
cold.
Cold showers will
even
change your
at
life.
this kind of weather.
So I do cold showers all throughout the year, but when it's winter time, I finish with a hot shower. I start cold to wake myself up and get all that, but then the rest of the day, not only will I be cold, but I'll shake someone's hand, and my hands are just so freezing.
Oh, shit.
I can't do that. So I finish with the hot showers when it's a winter months
Don't worry, we'll do a cold plunge in January.
I'm always down. Yeah. Okay, so we have an amazing episode today. Today's episode is all about why stretching is not helping your back pain.
It's not? Oh, shit.
So, Brandon, a lot of times people hurt their back and they feel that tightness there in their lower back and they think, oh, I need to stretch it. Stretching is going to take away my pain, right? But that's really not the answer. And as you're going to really dive into deep in this episode, not only is that not going to be the answer, but there's other ways to actually correctly and beneficially treat that low back pain. So to start off, there's a lot of common misconceptions about stretching being the way you want to treat it. And why is that? Why do you think people think that stretching is the answer, and why is it not the answer?
I'll say probably a lot of people want to stretch their back because they would see it either in media or their people in the gym stretching their back. And essentially when someone feels a pain in one area, they're going to focus all on that area and be like, all right, let me see what I can do so they can lean back like this, try to touch the toes. So that's probably one of the reasons why, and they think that they're doing something, but I would say what they're doing is, they're getting some kind of relief, but they're doing it in a wrong way because stretching it just kind of calms your body down and you're not addressing the root cause.
Totally. So, stretching is going to be something that, may take a little of that pain away temporarily. Massage, that's another example of something. What are some other examples?
I would say either foam rolling also.
Foam rolling.
Some people do that, or some people go through acupuncture.
E-stim, with those little electrodes, and it's feeling good. Those muscles are relaxing.
Yeah, or even going to a chiropractor. I love chiropractors, but a lot of people, general population, will go to a chiropractor once they're all like, oh, my back's not feeling good. Let me go to a chiropractor.
And that's the only answer. I just chiropractor and I'm good.
Yep, let me depend on someone for my pain relief.
And it's any of those things are going to temporarily take away some of the pain. And sometimes in that early stage of the injury, you do want that, right? You do want to help decrease and manage that pain, but that isn't ultimately going to heal your back.
Exactly. For a lot of my clients for lower back pain, I make sure that their pains calm down at a tolerable pain level, especially after a flare-up. And then once they're finally settled down, they're able to tolerate some movement, guess what? We're going to go ahead and work them into those movements.
Totally. So why don't those treatments work? Obviously, we just talked about why people might tend to gravitate there, what they do use. Why don't they work, though? Why isn't that the answer?
It isn't the answer because what you're doing is you're doing a cookie cutter or some kind of short-term relief. You're putting a Band-Aid on something that's a little bigger than the issue. You're putting a Band-Aid on a cracked glass. I guess that's an analogy. So what you want to find out is why is your lower back feeling like that? Because if you just keep doing your stretching, massaging, foam rolling, cryotherapy, or whatever, that lower back will probably settle down for a while, but then a few days or a few weeks later, that lower back pain is going to come back, and then you're going to have to do the same thing. Stretch, massage, chiropractor, cryotherapy, or whatever, and that cycle is going to repeat itself until actual tissue damage becomes more severe to where you feel the pain radiating down to your leg. It could definitely start affecting you to where you won't be able to stand up or walk properly.
So initially, maybe it's not a huge, it's not a huge deal, but it's not drastically affecting your life. But if you keep treating it with these ineffective treatments that only take away the pain for some time, that damage will become more and more severe until, like you said, now maybe your life's infected to where you can't actually work anymore, or you just have now maybe a herniation and your nerves are impacted and you have this radiating pain. Like, it can get really bad if you don't address those root causes and you just keep slapping on an icy hot patch and journeying through your day, you know? So that's obviously why it doesn't work. But, you know, there's a lot of different elements of what contributes to lower back pain, right? And I heard you saying earlier that strengthening, which is something that I definitely agree with, is going to be a huge role, right? Strengthening the surrounding muscles, those adjacent muscles to the lower back. So why is that? And then what are those main muscles that we need to focus on strengthening typically with a lower back injury?
Yeah, so you want to focus on strengthening the adjacent muscles or the surrounding muscles. Just because with the lower back, if you just look at it from like any anatomy textbook or whatever, the lower back only has like maybe a few muscles and they're very small.
Yeah.
Like, you know what I'm talking about? They're like almost like maybe double French fry size.
Yeah, just like
that, yeah. Yeah, so just imagine, compare those muscles to those bigger glute muscles or even like the core muscles in the front or even like the lats. So those muscles will, first of all, they tire out easily just because of the size and the kind of fiber they are. So that means when you are walking and doing your exercise, when those muscles are fatigued easily, and that means one of the other muscles have to take over, which is the glutes or the lats or the core. But if those three aren't strong enough, those other muscles aren't strong enough, then it just goes straight to the lower back.
Which is a flimsy little weak muscle, or to put it more scientifically, it has the more endurance-oriented fibers rather than those strong, fast twitch fibers.
Yeah. Oh, no, it doesn't have endurance.
Oh, it doesn't?
Well. Yeah.
Oh, excuse me. Yeah, the opposite.
Yeah,
the opposite.
Yeah.
It's something that it's not going to be able to sustain that all day. Just like those little muscles where they're going to get fatigued easily, and if your lower back is just, the muscles are relying on that, after a couple minutes, it's going to start adding up. You're not going to be able to go a whole day supporting that.
Exactly, and that's why it's important to look at those adjacent muscles. And
totally.
To answer your question, it would be most likely the hips. A lot of my clients with lower back pain, they have a lot of hip mobility and strength issues. So that's the number one thing I assessed along with their lower back exam. And then I also look at their core activation. I see if they know how to even like contract their core or how to even like move their pelvis forward and back. Then I'll also look at mid back, which is the thoracic. I look at mostly their rotation and if they have good strength in terms of like their lats.
Got you. Yeah. So those are all the different areas that you're looking at. And then obviously one thing that we really want to do if we find a deficit in an area is to strengthen that area. But you also mentioned that there could actually be a benefit to stretching a certain muscle, right? So why don't you talk a little bit about obviously, you know, some simple ways we could go about strengthening each of those areas if needed, and then when we would want to stretch a muscle group, you know, like an opposing muscle group.
Yeah, so we'll start with the hip first. So with the hips, like what I said before, very common with strength and mobility issues for people with lower back pain. So one thing that I see with a lot of people is that they don't have that hip extension, or they're not able to pretty much bring their hips up strongly. Yeah. So one exercise I would give them is like a hip thrust or either a glute bridge. Yep. So that's a big one. And also, if we're still talking about the hips, I would also even look at people's internal rotation and external rotation of the hips. So yeah, so what you're doing right there, that's internal rotation. A lot of people, they could probably go that far, but they're not able to like control it. If I were to put you in like a 90-90 position or an isolated position.
My internal rotation's pretty bad.
Yeah.
This is the most I can like actively go.
Exactly. And a lot of people with lower back pain have that same correlation. Unfortunately.
I'm learning some things about myself.
Right, yeah. So a lot of people, what I give them is I don't even give them just hip strengthening. I also give them hip mobility drills that helps them control that rotation as well. So hip rotation is important. Yeah. And if we're still on the hip flexion to bring your knee up, like in this motion here, like you're marching. Yeah. That motion is actually very tight on a lot of people with lower back pain. Yeah. So what I do is I actually give them more mobility exercises, like a half kneeling stretch to stretch that hip out, the front part of their hip, to help loosen it up. Just because the hip flexors, we're sitting like for like at least like 7-8 hours a day. Yep. So
this is the tight position of your hip flexors.
Exactly.
The contracted position.
Yep. Like right now, my hips are very they're not contracting, but they're put in a shortened position. Sure. And then right now my glutes are actually put in a stretch position. So if I pull it right here, I'm stretching my glutes. But my hips are like this for about 8 hours a day.
And they're kind of shut off, like meaning that they're not actively engaging and extending.
Yeah.
So, well, a lot of people who have lower back pain, they need that extension, they need that engagement. But if their body's really used to having that shorter position in the hip flexors, which is not conducive to hip extension, well, it's actually good to maybe stretch those hip flexors in like a half kneeling, and then work on strengthening the opposing muscle group, the hip extensors, your glutes.
Exactly, and you want to make sure that you're efficiently strengthening the glutes first by stretching out the hips.
Yeah.
Yep.
Awesome. So that is going to be the hips, right? And as you mentioned there too, obviously with the hips, it's not just hip flexion and extension. There's also the element of the internal and external rotation. So those are all things you may need to address.
Yeah, big time, especially the hip internal rotation.
Well, then let's talk about the core. Obviously, a weak core can really contribute to lower back pain. And I know when a lot of people think of the core, they just think of the six-pack muscles, right? Those muscles they can see, but there's a lot more to the core.
Yeah, so if you look at your stomach right now and you look at the six-pack muscles, go ahead and rip those six-pack muscles off. All right, and then after that, you actually have some obliques right there that are right under the six-pack muscles. Go ahead and rip them off. All right, so now you have something called the transversus abdominis. And it's actually one of the core muscles, one of the only core muscles that's like very directly inserted to your lower back or to your spine. So that means if you were to contract that muscle, you can actually pretty much move your lower back directly. So that muscle's, I guess its role is to protect the organs in there and also protect the spine. So when you stiffen up, like an exercise like a plank, for example, you're able to kind of better contract that whole area to protect the spine and also to protect the organs as well.
Yeah, the cue that oftentimes people give to activate that TVA is sucking your belly button into the spine, right? Or I like to think like pulling your belly button in like you're trying to fit into a skinny pair of pants, a tight pair of pants. That's going to activate that muscle. And oftentimes, like what I've noticed with people who have lower back pain is they can't do it. They have no TVA control. And there's more complex ways to assess it. Like there's this one really good way I learned where you actually put a blood pressure cuff.
Oh, I like that one.
Under the lower. You learned that? Okay, cool. Yeah, and under your back. And then there's these really simple movements you can do, but essentially you're trying to maintain that certain pressure on the cuff. So if you suddenly like let your stomach come out, that's putting more pressure on the cuff, showing that you have a little dysfunction. So there's like ways to assess it, but ultimately most people will benefit from strengthening their TVAs.
Exactly. And then also like what you said, like that, what you just mentioned was like the most regressive or like level 1 form of like contracting that TVA muscle.
Totally.
Because the more advanced way is what I see some people jump right into before even doing that assessment is like doing a cat camel on their hands and knees in that quadruped position. And you could do that. That's
what
fine.
Is a cat camel? Obviously,
cat camel is on
cat
your
cow. Is that
it's a cat cow.
Oh,
yeah.
okay.
So it's like
thing.
your hands and knees, and all you're doing is like pretty much tilting your pelvis up and down, or you're pretty much like showing your ass and then tucking in your tailbone.
Yeah.
And then a lot of people do that motion, and they think that like it's gonna relieve their back pain, but a lot of them they're actually using more of their upper back to do that motion instead of all lower back.
Because if lower back is the point in that exercise, you want to actually work on your pelvis.
Pelvis, exactly, pelvis movement. So that's why like with a lot of my clients, I teach them that while they're laying on their back first, and then I progress them to okay, let's go ahead and do it with if they could do it with their legs up then or legs down, and then to that quadruped position. And
this is a really quick aside, like with that pelvis, a lot of people who might be trying to strengthen their glutes, whatever, and have lower back pain, those lower back muscles are going to be really tight, really turned on. You're going to maybe naturally have a little more of extension in that lower back, where then if you go up to do like a hip bridge or something, you might be more likely for those lower back muscles to jump in. So if you can do this pain-free and comfortably, you actually want to get a little bit of like a posterior pelvic tilt where you take those lower back muscles out of it, which essentially it's where you're going to like tuck your hips under, like you're trying to take your butt away.
Yeah, or you're talking about for when someone does like a bridge? Or
like with a bridge specifically,
Yeah, you want to actually be in a slight posterior pelvic tilt, which is that TVA activation to bring your hips up, because that puts the glutes at like a better I guess, a better position to contract.
It's going to be more pure glutes. Now, question I have for you based on what you just said. Will your TVA inherently contract better in a posterior pelvic tilt? Is that
So when you contract your TVA, you are in a posterior pelvic tilt.
I guess it's hard to pull your belly button in like that, but the muscle inherently engages with that posterior pelvic tilt. Like your TVA can still be contracted when in an anterior pelvic tilt, right?
Yeah, as long as you're contracting. It's the same as like I can still contract my bicep when I'm straightening my elbow. It's the same thing.
But it's not as conducive.
It's not as conducive. Yeah.
So that's a great point.
Yeah.
And I actually didn't know that it was more. I obviously knew those things were related, but I didn't actually realize that it is going to contract better in the posterior pelvic tilt.
Oh, for the TVA? Or the
TVA stuff. That's really interesting.
Yeah.
Well, okay, so we just covered a little the glutes. Obviously, we're just talking about those core muscles now. But when we talk about, or the abs specifically, when we talk about the core, though, we're not just talking about those ab muscles. So we talked about those deep core muscles.
Yeah.
Well, we also have the side of our body, right? Our obliques, which are going to affect, our lateral flexion, our rotation. Yeah. So why don't you dive into the obliques a little more?
Yeah, so with the obliques, they actually, so let's go back to our anatomy to where it's like I rip your six-pack off. All right, so now we have those layers that we kept on. So it's the obliques. So those help with any kind of rotation, like this right here, rotating your torso left and right. And we actually need that for basic just living, because I'm pretty sure we've never gone a day without rotating. You know what I mean? So we want to make sure that those muscles are actually strong. All right, because if let's say we start rotating and those muscles are weak, those muscles are active structures. So if they're weak, most of the force from the rotation goes to a passive structure like the lower back, especially when it's directly that close to the lower back.
Yeah.
It's very important to keep strengthening those muscles. Yep. And then I will say that like some people, when they have like a right side lower back pain or left side lower back pain, they could be tilted or rotate to one side than the other because one side could be more contracted than the other. So that's why some people have those tilts.
Totally.
Yep.
Totally. So it could be an imbalance in between sides as well as just the muscle itself, a general weakness.
Yeah.
So, obviously those adjacent supporting muscle structures are going to impact that. Are there any I missed that you would want to
I would also say the multifidus.
Oh, the multifidus.
Multifidus, yeah. So that muscle actually goes all the way from like the back of your neck all the way down to your posterior pelvis or the back of your hips.
Yeah.
So it's a very big muscle. It's one of those still smaller muscles.
All along your spine.
All along your spine, yep. It's still one of those smaller muscles where some people think like, oh, it doesn't do anything, but it actually does a lot, especially when you do some kind of like extension, like what we were talking about before, the hip extension.
Yeah.
The multifidus actually helps with that and also helps kind of keep your core in place as well, same as the TVA. So they go hand in hand.
Yeah, they're antagonist muscle groups, right?
Yep. But I would say that the multifidus always kind of forgets how to contract every time the back gets injured. So that's why multifidus training is a big thing that I give to all my clients with like lower back pain, because if they don't know how to use that multifidus, then they're going to be lifting only with that passive structure, which is the lower back joint.
Yeah, that's really good. Yeah, so again, multifidus is going to be more extension related, right?
Like extension. It's more stabilizing the lower back and keeping the lower back stable while the hip comes up. So an exercise that
we train it through extension, right? Or not necessarily.
We train it through
isometrics as well.
Through it could be isometrics, or it's mostly seen in exercises like a bird dog. Where like opposite arm, opposite leg comes up.
Totally.
Yeah, it's more seen in those kind of exercises.
Interesting. Okay.
Yeah.
And then I think there was one more structure that we may be forgetting.
Oh, the mid back.
So your lats as well, yeah.
Yeah, I would even go all the way up to like the mid back in general.
Rhomboids,
and even the actual thoracic joint itself, because like you know how like with your injury, like you have like a mid back rotation or rotation limitations. People with lower back problems also have rotation limitations with their mid back, because their mid back, their thoracic spine and lumbar spine, lower back spine, are like right on top of each other.
Yeah.
So any kind of rotation that the lower back doesn't do, the mid back is being affected, and vice versa.
Yeah.
So rotation's important of the mid back, and I'd also look at like what you said, the lats. Just because those lats, a lot of people think about it as just like, oh, it's just right here, it's your wings.
Totally.
It's all mid back, armpit area, whatever. But they also connect all the way down into the back of your hip. They fan down into the fascia, thoracolumbar fascia, and then
fascia is the stuff that the muscles kind of tie into.
Yeah, exactly. That's how they are kind of connected. So when it connects down there, your lower back can still get tight, and when it feels tight, one common concern is because of the lats being super tight because of that fascia. So kind of either mobilizing the lats or strengthening it. It really depends.
Totally. So, it can be very nuanced, and I think that's where, obviously it's always best if you have that resource to go to a physical therapist, right? So before we jump into that, I will in a moment want to know, if you don't have access to a physical therapist, which almost everyone does with insurance and everything, or, there's some really great cash-paced PTs out there in San Diego specifically. But so we'll get into, what to do on your own if you don't have those resources. But first, what are some other things in addition to those adjacent muscles that will affect it? So obviously one thing I'll point out right now is just sustain positions throughout the day, right?
Yeah.
Like if you're constantly sitting and you just are super sedentary, that's almost a guaranteed recipe for most people for some sort of lower back pain.
Oh yeah, like especially because remember we talked about how pain is like a danger signal from the body.
Yeah.
So when people are sitting for a long time, their lower back starts aching and all of that, and it tells your body, hey, you got to stand up and start moving around. You've been sitting for 4 to 5 days or 4 to 5 hours.
Damn, 4 to 5 days?
Well, I know, 4 to 5 days, jeez. So yeah, definitely sitting and looking at sitting for a long time or even standing for a long time. Because when we're standing for a long time, those spinal rector muscles, they still stay tight.
Yeah.
Yep. And then besides sustained postures, also stress levels as well. So
totally.
If you're not getting enough sleep, if your work is very demanding, or if you're having some family issues, that could add stress. Your body sees all that as stress, and anytime you have some kind of stress, your body's in that survival, fight or flight mode. And when that happens, it's just going to stiffen every single thing in your body that's already had some past injury, like the lower back. So it's going to stiffen that area up.
Totally. And I don't know if this is exactly the same, so correct me if not, but a way I like to frame it to understand it is if you think about, oftentimes when we're kind of tense or stressed, a lot of people tend to shrug those shoulders up, right? That's a common thing. Well, that's not the only muscle that tenses up in your body when you're stressed, right? Maybe that's the thing most people will notice, but yeah, a very common one is to hold tension or stress in your lower back. And I can say with certainty that there's been times in my life where, maybe I'm financially stressed, or I just have a lot of work stress, or whatever it is, I will feel a slight flare up in just general some lower back discomfort. And if I look at my training and everything else, nothing really has changed there. I'm not doing anything wrong per se.
Yeah.
But stress will impact pain.
Definitely. And it's not even if you'll notice, you won't be when you're super stressed out, you won't notice oh, I'm really arching my back a lot. It's gonna be more systemic to where it's your center of mass, or you're really shifted back a lot, and that puts a lot of stress on the lower back joint.
Totally.
So when you're shifted back a lot, that's usually a common thing.
Yeah,
Putting a lot of stress on the lower back.
I had a client actually who she had really conditioned those muscles to want to be really extended. She had an intense anterior pelvic tilt.
Yeah.
And this was really interesting to me, but she said whenever she got drunk, naturally she would shift into that position back, and her lower back would tighten up a ton.
Oh shit.
Whenever she got drunk. So that's just, I don't know if that's more stress on your body from being intoxicated, or if just she wasn't aware of it. I don't really know why it was happening, but it's just kind of an interesting anecdote, you know?
I mean, also I would have a theory. It's because when people I'm not sure if I'm right with this.
Yeah.
But when people are drunk, they kind of revert back to their path of least resistance. They go back to their old habits.
Totally.
And that could mean in biomechanical standpoint. So she probably was just newly aware of that, and then once she started drinking, she's all okay, I'm going back.
Well, I'm used to. Yep.
Yeah.
Yep.
I'm going back to it.
So that's all really interesting, and as we were just saying, somebody might not have the resources of a physical therapist. Most people do, and I urge everyone out there with pain to seek out a physical therapist. But if they don't, one thing that I found can be really helpful for some of my clients who maybe they just have a little pain and they don't necessarily have the motivation to go to a physical therapist, but I see them there, they're not feeling great. I have a very good understanding of the body. I don't know all the assessments someone like you, a doctor of physical therapy, does, but I generally know things that are going to help. So that's a situation where I'll kind of tell them, look, this isn't going to be as effective as going to a physical therapist, but let me give you a shotgun approach. Let me give you some general stretches and strengthening exercises that will probably help to some extent. So, is that something that someone on their own should employ? Are there self-assessments someone could do?
So I would say if that's your only resource of if you as a trainer trying to help someone's lower back pain, if that's the only resource that they're willing to do or you're willing to do, then that would be good, because I would say something's better than nothing.
Sure.
But however, there's another saying where if you're not assessing, you're just guessing.
Yeah.
That's another quote also.
Yeah.
So I would honestly, if you can't go to a physical therapist, I would try to search up some kind of YouTube video of self-assessments for, let's say, squat, lunge, even like lower back mobility self-assessment. There's a lot of those on YouTube. It's very generic.
And not all of it's very hard to see. Like, I'm sure it does get very complex.
Yeah.
But some of it can be pretty clear oftentimes. Like if you have a very distorted posture or,
Yeah, so you could even like film yourself doing an exercise and then compare it to like someone who has good form off the internet. So that's one thing that you can do as a self-assessment.
Yeah.
Obviously, there are other stuff that goes into that, but that's like a good resource for you to have as a self-resource. And also, I would even look at like more like the person's like actual activity level. Just because we talked about sustained positions, how it causes lower back pain, you could ask them like, hey, are you getting enough movement throughout the day, or are you just sitting at your desk for 4 to 5 hours? Pretty much. Are you adding an extra 10 minutes to walk after dinner? Doing any active stuff on the weekends? And then even ask them like what kind of movement are they doing on their own, or what kind of movement are you giving them as a trainer?
Totally.
Are you training them only in one plane, which is just a flexion extension, forward and back? Or are you actually being consistent with them and doing more rotational movements so they could visit those planes, or like a lot of suitcase carries, or like quadriceps lumborum side bends?
Sure. Another thing I've noticed too is oftentimes you can identify based on what lifts they're weak in. So I have some clients who they're really weak with a hip thrust. Like this guy overall pretty strong, can squat a decent amount, but when he gets to a hip thrust, he is so weak. Same with a Bulgarian split squat, right? So you start to go, okay, they have weak glutes, right? Okay, now some lower back pain's flaring up. Well, what muscle is clearly really weak? The glutes. If we strengthen the glutes, will it help with their pain? Probably.
Yeah.
So definitely identifying like areas where you're disproportionately weak can be really helpful as well.
Exactly. And also like you also don't want to neglect the mobility as well.
Totally.
Because you could have those people strengthen the hell out of their glutes, their core, but if their joints are like not moving efficiently in a biomechanical term, then that just might cause more stress.
Yeah.
So you want to make sure their mobility is good as well. So that means improving your range of motion, not just like saying, oh, you're able to touch your toes, great job, that's mobility training. No, you want to be able to kind of own that degree of motion. So instead of you trying to touch your toes, you can sit on your butt on the floor and keep your chest up, spine upright, and try to bring your leg up.
Yeah.
That's the same position as you touching your toes, but the reverse way. And you want to make sure you're able to control every single degree. So that's where like, flexibility and mobility are very different.
Totally. And like you said, range of motion, but like a controlled, owned range of motion.
Yeah.
Because there was definitely a time I remember like doing these like really deep squats with like some heavy weight. And my back hurt after.
Yeah.
And the reason was I could physically get super low, but when I got that low, I stopped using my glutes, I stopped bracing my core.
Exactly.
So I didn't own that range of motion.
Yeah.
So that's important to
you
know
can
as
even
well.
tell like with clients if they're doing like a warm-up weight with like a lunge or a squat and they're shaking all the way down and up, you'll know if like they own that range of motion or not.
Lacking some stability right there.
Yep.
Yeah. So guys, this is an important episode. I hope you listened all the way through, because Dr. Brandon was just schooling us with some really important information on, why stretching isn't going to be the best thing to do for your lower back. As far as, anything else you would add, are there any things you want to leave us with on this episode?
Probably the last thing I would say is in terms of like assessing your own like movement, I would look at to see if you're doing any kind of fear avoidance behaviors, because that's a big one that I see with lower back pain patients, especially with patients who have had that lower back pain for like maybe 6 months plus or a year plus. They would start avoiding trying to tie their shoes, trying to pick up stuff from the ground. They would start hip hinging to go feed their dog or wipe poop off the ground or something. Or to pick up their kid, they would start hinging. So when you start doing that, you're telling a lot of muscles, including that multifidus muscle.
Oh, wow.
Yep, to say, hey, we're gonna not use you anymore. We're not gonna use your spinal flexor muscles anymore, because we're all about hip hinging. This is how we do everyday life. So once you tell your body to do that for about 6+ months, your body starts to get used to it, So when you do accidentally visit the motion of you bending over using your spine, then you will start to feel a flare up because your body hasn't been accustomed to that motion in a while. So if you're avoiding movements, don't avoid them. That's the bottom line, because what you want to do is you want to find out why you're avoiding it. Is it because something's weak? Is it because something's not mobile? Or are you just scared of going down there? And then you want to progress into doing that full range of movement that you're avoiding slowly.
Totally.
Yep.
Brandon, good stuff.
That was
if
good
you
stuff
guys
right
made it this deep into this episode,
Right.
this was one of our longer episodes.
I know, right?
So we appreciate you. Leave a comment in the comments saying fitness / I don't know. What should they say if they've made it this far?
Perform better.
Perform better.
Perform better.
Guys, thank you so much for watching.
Also, if you guys have had any back pain stories, feel free to share us through the comments or send us a DM.
Please do.
Yeah, but other than that,
we love you. We love our listeners. We'll see you in the next one.
See you next one.